Imagine. Everyone, please close your eyes tightly. Imagine life if you were unable to see. Could you find the toilet or leave in an emergency? Now imagine you live where there are no paved roads, no clean water. In our world, 40 million people, more than the entire population of Canada, are blind, unable to perform the daily tasks of living. 90% of the world's visually impaired live in low-income settings. 85% of the blindness on our planet could be cured or could have been prevented. 20 million people are needlessly blind from treatable cataracts. Now imagine there exists a surgery that can restore perfect sight to these people in 5 minutes for a cost of $20 per surgery. Imagine we can overcome all the needless blindness in our world. People say it's impossible. It's time to dare the possible. Please open your eyes. Impossible becomes possible with the first step. This image is of Mount Everest, a metaphor for achieving a goal. In 1983, when we set out to climb the east face, or Kangshung face of Mount Everest, we were told it was impossible. The lower head wall you're looking at is 5,000 vertical feet, with technical difficulties similar to rock climbing El Capitan with vertical ice at altitude. And we'd be climbing from Tibet with no native support on the mountain, whatever. So how do you dare the impossible? First, you have to put in the years of climbing and training and push yourself to your limits at altitude. But we were venturing into a realm of technical difficulty at altitude that had never been attempted on an 8,000-meter peak. While we may not have been the 12 best individual climbers in America in 1983, there couldn't have been a better team. We shared a passion, commitment, and a willingness to dare the impossible. Success is the result of action, not dreams. On October 8, 1983, we completed the first ascent of the east face of Mount Everest. 31 years later, our route still has never been repeated. So what does this have to do with world blindness? Well, first, the opportunity to climb in Asia and Africa allowed me to witness firsthand the consequences of extreme poverty on health and the disparity in healthcare systems throughout the world. And my focus was already on global health by the time I matriculated at medical school. But I also got to know Sir Edmund Hillary, who hiked into base camp on the east face of Mount Everest with us. And Hillary's one of my heroes, not so much for what he's done in the climbing and exploration realm, but for what he's given back, building schools and hospitals for the people of Nepal. And I had the opportunity to work as a doctor at one of the hospitals Sir Edmund Hillary built. And many of the problems I faced were really public health issues, problems of poverty. I had emaciated children come in with diarrhea that I'd rehydrate, give antibiotics. And then 2 weeks later, the same child would come back just as sick. I watched children dying of diarrhea, pneumonia, and things that would be so easy to treat in the Western world. But I also had the opportunity to see the impact of blindness. And in the village where I lived, it was just accepted. You get old, your hair turns white, your eye turns white, and then you die. And this is a mature cataract. And the person with this cataract would only see the shadow of a hand move in front of their face, really only light and dark. But I also saw the effects that the blindness had on the people. They'd become shriveled, depressed. And the life expectancy, once a person goes blind in the developing world, is 1/3 that of healthy peers. And for blind children, the fate is much worse. The devastation of blindness also extends beyond the individual to the family and the community, because it takes an able-bodied person out of the workforce to care for the blind person, or a child out of school to lead their father around by a stick. Another expression for a blind person in Nepal is a mouth with no hands. But when I was in Nepal, I watched a Dutch team come in and perform cataract surgery, taking out the cloudy lens and putting a lens implant. And this not only restored sight, but it restored life to the people in our village. One day after surgery, people were straightening up and blossoming, and they looked 20 years younger. I returned to America, trained as an ophthalmologist, did advanced training in complex cataract surgery and corneal transplant surgery, and then returned to Nepal to work with Dr. Sandak Ruit, my elder brother and the genius behind everything we've been able to accomplish. And Sandak was born in a small hill village, 4 days' walk from the nearest road. He went on, started school at age 8 in Darjeeling, India, earned scholarships to the best institutions in India, trained as an ophthalmologist in India, then did fellowships in first the Netherlands and then Australia. And he returned to Nepal with a full knowledge of absolute state-of-the-art Western eye care and the best Western eye surgery. And he began to imagine, how can you bring the same top-quality care to the poorest of the poor in Nepal at an affordable cost? Prior to Dr. Ruit returning to Nepal, all of the cataract surgery performed in Asia and in Africa for the poor people was a very crude operation where we basically spliced the eye in half and removed the whole lens. And if the eye survived that surgery, they get these thick Coke bottle-like lenses that in the best of circumstances give a distorted vision. This is a woman with those aphakic glasses leading her sister for 3 days to come see Dr. Ruit in one of his outlying camps. Dr. Ruit had already developed a system with eye care delivery that the quality, sterility, and infection rate is the same as we have at the best centers in the West. And the cataract is a clouding of the proteins of the lens of the eye, which is just behind the pretty colored part of the eye called the iris. And in modern cataract surgery, we make a small incision in the eye wall that's self-sealing. Open the outer capsule of the peanut M&M, take out all of the cloudy proteins, clean the capsule out, and put a clear lens implant into the lens capsule. And one problem when Dr. Ruit returned to Nepal was that the least expensive lens implant on the world market was $200. This is more than the average yearly income of a Nepali citizen. And Dr. Ruit had the genius to team up with an Australian ophthalmologist named Fred Hollows to raise the funds to start the first low-cost intraocular lens factory in the world. And these lenses are exactly the same quality as what I put in America, but they cost $4 a lens. And then instantly brought the cost of the overall cataract surgery with locally manufactured materials to $20 per surgery. And I came to Nepal. I worked side by side with Dr. Ruit. This is a schoolroom at 10,000 feet that his team sterilized. And we worked side by side for 3 days. And in 3 days, we restored sight to 224 people. Now, that sounds semi-impressive. No, that's impressive until you get the breakdown that Dr. Ruit did 201 surgeries while I did 23. But the results were just absolutely incredible. The quality, we have about 80% of our patients see well enough to pass the American driver's test 1 day after surgery. Those of you who are squeamish, please look away. This is a video. I'm only going to be showing a couple of minutes of it. But it's, in all, a 9-minute video showing 3 complete surgeries. The quality of the video is not great. It was recorded in India. But basically, Dr. Ruit developed a technique of doing the same quality eye surgery that I do for $3,000 here in the United States for $20 without the expensive machines. This is making the self-sealing incision into the eye wall. But it's more than just the surgery. It's really a team approach. And Dr. Ruit developed a system where no one does anything that someone with lesser skills can do. We started a program, which is a 6-month program after 8th grade to train ophthalmic assistants, a 3-year program after 12th grade to train ophthalmic technicians. We began training the existing ophthalmologists to perform better surgery, and this is completing the self-sealing incision at 1 minute into the surgery. And then we began taking our best young cataract surgeons from around Nepal and sending them to the United States or Australia for subspecialty training. And we started a full residency program exactly equivalent to our American residency with our new subspecialists as the professors teaching in the surgery. And developed a system of outreach to reach the poorest of the poor. We have primary eye care centers dotted now through the hills of Nepal that are manned by the ophthalmic technicians and ophthalmic assistants who do a large amount of the work. You can see now we're at 1 minute 40 seconds into a cataract surgery. The cloudy lens is about to come out, but you can see on the back table in that little yellow square, the next patient's already being positioned, prepared, and readied for surgery. So at 2 minutes, the hard peanut has come out, and we're ready to clean up the chocolatey mess. But what we've done is we've created a system to try and reach the poor. And prior to when we started, no one knew they could have their sight restored. So people didn't really come for surgery. So it's a matter of education and teaching, not just the doctors, but really creating the whole system. And a primary eye care system with primary eye centers dotted through the hills of Nepal, referring to cataract centers throughout Nepal. And then we have a great subspecialty full-service eye hospital, the Toganga Institute of Ophthalmology in Kathmandu. And you can see it about 2 minutes and 30 seconds. Everything is nice and clear. And we also developed a cost recovery model where we have the elite of Nepal pay for their services in Nepal that provides a cross-subsidy to provide free care for the poor. And by engaging the powerful, we're able to give great care for free to the powerless. And we go beyond just teaching a man to fish. We're teaching fleets of fishermen to cast their nets widely. And through quality, which is really the essential ingredient, we teach them how to sell the fish. And we've begun to actually reach the poorest of the poor. And you can see at 3 minutes and 12 seconds, we're just finishing this surgery, restoring perfect sight. And 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 5 seconds later, we're starting the next surgery. And with this system, a single doctor in Nepal can provide more than 100 sight-restoring cataract surgeries in a day. When we started, there were more blind people from cataracts in the Himalayas than there are people in the entire state of Wyoming. And now Nepal, the poorest country in South Asia, went from having 15,000 cataract surgeries performed per year in 1994 to 300,000 cataract surgeries in 2013. And the rate of blindness in Nepal has dropped from 1 blind person per 100 to less than 0.2%. And people wonder, how good is the quality? What are these people really seeing right after surgery? Well, we performed a prospective randomized trial, bringing kind of the marquee surgeon from America, David Chang, who's a professor at the University of California, San Francisco, to Nepal. One of our big ophthalmic pharmaceuticals reconstructed his entire operating room in Los Gatos, California, in a monastery in Nepal. And he and Dr. Rui operated side by side. And the only difference in results were the cost and the speed. Dr. Rui was 3 times faster and 10 times less expensive. And at 1 year, we have a 99% success rate. So imagine, we can cure 18 million blind people. We have taken the first step. Quality, high-volume surgery has spread from mountainous Asia into India, Bhutan, Tibet, and we're bringing the system to Africa. In America, we have 1 eye surgeon for every 18,000 people. In much of Africa, there's barely 1 ophthalmologist per million. We're using our base in Nepal to train doctors from Africa and all over Asia. We've established training centers now in Ghana and Ethiopia. And as we're teaching and expanding, it's important to keep in mind that although the statistics say the number of blind people on our planet is still overwhelming, as we work, we're curing people. Each person is not a statistic. They're individual people who are having their sight restored 100%. Imagine, in the time it took for me to give this talk, 2 surgeons working in Nepal could have restored sight to 6 people for a cost of under $200. It's time to dare the impossible. We have a great team. We need more people with passion, more people with commitment. In the world of global health, there are few areas where we can absolutely win. Helen Keller said, "Because I cannot do everything, I will not refuse to do something I can do." And eliminating needless blindness is something we can do. Imagine.